Well, welcome everyone. Just wanted to thank you for joining us for this conversation hosted by DPC's Education Center. My name is Hirancham Goshen. I'm the CEO for Dialysis Patient Citizens. And today our discussion is going to be focused on DPC's advocacy efforts to advance public policies that ensure fair and affordable access to health insurance coverage, especially Medigap. We're thrilled to be joined by a panel of incredible advocates who will share their personal stories, their connection to DPC, and the vital role that patient advocacy plays in shaping public policy. So, with that, we're going to get started, and I'm going to turn it over to Gene.
Hey, my name's Gene Blankenship. I'm a proud DPC board member. I've been with DPC for a few years now. Before I joined the board, I was a patient ambassador, and I absolutely loved that. Loved working with Pam and Yolanda and the others there at the staff, Hannah and Megan. Anyways, I was diagnosed with polycystic kidney disease in 2003. Found it at a routine doctor's visits. I have since been on dialysis for 3 years, and then I just recently had my kidney transplant 2 years ago in February. I got my transplant at the University of Arkansas. Things have been going good ever since. The kidney's still functioning great. I just had a meeting with my surgeon last week, and things are going very well. But advocacy is such an important part, not only for what we do here at DPC, but just in general. You have to have a voice and you've got to be able to let people know what's going on, and you got to be able to raise that awareness. And you are the best person to do that. Your voice, your story is so important. And so I'm really excited about this. I'm so glad that DPC is doing this, the DPC Education Center. I'll turn it over to my friend Chris here, and we'll go from there.
Well, good afternoon, everyone. My name is Christopher Richards, and I've been on dialysis for 8 years this coming October. October 30th, 2017 changed my life. I went from being a full-time worker to actually going to dialysis three times a week, 3 hours and 45 minutes. So it's been a life-altering experience. Um, this is my second year with DPC. I'm on a patient ambassador, and I've really loved it. I never thought that looking at a email on Facebook that would change my life tremendously for a positive way. Dialysis is a great thing. DPC is a wonderful, wonderful organization, and I'm so glad that I found it. Um, Being an ambassador has brought me out of my shell because when I first was diagnosed with dialysis, I was really quiet. And becoming a patient ambassador, it has given me my voice, and that I thank DPC. So once again, I'm really grateful, and I hope that people who listen to my story really think about becoming an ambassador and help get in the fight with us.
Well, Chris, Gene, thank you both for not only being on this discussion as panelists, but also for your dedicated advocacy efforts. Well, we can't thank you enough. As I think Gene had mentioned, really, it's critical that policymakers hear your stories. And there's no one better to tell that and to explain what patients, are going through. And so if it's okay, I'd like to ask you, Chris, to speak briefly about some of your firsthand experiences when it comes to getting access to affordable health insurance coverage and how you've used that story to impact legislators in your state.
Um, I have Medicare, which is that you automatically get becoming a dialysis patient, and also have private insurance. But I have private insurance through my ex-wife's insurance. It's her insurance that pays my 20% premium, and from that I am grateful because I have friends who are on dialysis and they don't have that private insurance, and without having that private insurance, even having Medigap, you have to make tough decisions during the beginning of the month whether I'm going to pay my 20% that I owe, or am I going to buy food, or I'm going to buy gas, or even having money to get to back and forth to treatment. So having Medigap is a big relief for some people. And believe it or not, a lot of dialysis patients don't even know that Medigap exists. I was talking to some people at my clinic, and they was like, "Well, what is it? I've never heard of it. What does it do? How do you go about applying for it?" And I think that being an ambassador, that I need to have, I need to get more information to my actual clinic, so that a lot of people can be aware of what's going on, because there's a lot of patients that's out there that just lonely and don't know, and there's a lot of patients that are quiet, like I was when I first started. And so having Medigap will become a tremendous relief for them.
No, thanks, Chris. And I know you've been working hard in Georgia to advance legislation in your state. Your state actually requires the Medigap be offered, but the premiums are up to 10 times more expensive for patients under 65 on dialysis than they are for other patients. And I think that's led to DPC to some of its efforts and some really exciting wins recently. Texas, Nevada, Delaware, Rhode Island, just this past year. We've successfully advocated to pass legislation in Kentucky, Indiana, Virginia, Connecticut, other states as well. And a lot of that is because of individuals like yourself sharing your experiences, your stories, what it means to, how do you make up for the 20% that Medicare doesn't cover?
Exactly.
What are the difficult questions that you have to make those trade-offs? And, I often say that when people ask me what I do for a living, I'd say I remind policymakers that, dialysis patients aren't just a line item in the budget, that they're real people and, have a tremendous impact in their communities. And so, if it's okay, Gene, I'd like to pivot to you to hear more about how you're working in your community to elevate the patient voice, whether at the local, state, or even national level.
Yeah, so and like Chris, I started out and really gained my voice through advocacy efforts and through getting mentored by people like yourself and others. And so what basically I have done is I've tried to find niches within my area where I can go fill in some gaps or I can go raise awareness and stuff. So obviously we're all in dialysis units. Well, each dialysis unit has their own social worker. They've got their own staff, and they may or may not know what's going on a national level. They may or may not know what's going on state level. So I think it's our jobs as ambassadors, as board members, and then just as patients themselves to educate those that are trying to help us, because there's a lot of information that is flowing around out there. And the sad thing about it is there's good information and there's bad information. So we want to make sure the right information is getting to the right people in the right places and stuff. And so we've really, as me being a Cherokee, and I'm a proud Cherokee, I've really reached out to some Native communities, working with several local tribes. Just so everybody knows, there's 569 Native American tribes. I say to Native American, we were First Nations. We were the ones here first. So First Nation tribes here in the United States, there are 39 in Oklahoma. That's why they nicknamed us Native America. And so I just recently had a tribal summit. It was the first ever in the nation, a kidney tribal summit. The Citizen Potawatomi Nation hosted that at their casino. I think we had 34 tribes there. And through that meeting, DaVita was able to bring and share all the different latest technologies for dialysis, what's happening, what's the research, what things we're looking at. We had Congresswoman Bice's office there. We had Senator Mullins' office there and Senator Lankford's office there. We also had DPC. The event could have not been put on had it not been for DPC. We had AKF and NKF there also, but bringing everybody to the table, bringing everybody together and starting to talk and actually having those conversations, I think is a big plus. And I think through those, you develop rapport, you develop a camaraderie, and you all start teaming up on these issues. So it's not just a solo project anymore. So we've got several other projects we're working on. We're going to be going to the Arkansas State Capitol and spending a day with some other ambassadors out there. We're doing local events in our dialysis units. We had a Christmas party at one. That's now going to be expanded to 4 different dialysis units this Christmas. And it all starts because that all started simply because an idea and a couple of conversations. That's how it all started and stuff. And so it's continuing to grow. And we've had a lot of success at that. Anyways, I want to encourage everybody, and you feel free to reach out to me. I'm happy to share my roadmap with you on the things that I've done to help me kind of advocate. And I know Chris is the same way, and DPC will step up to the plate and help out. DPC's literally been a phone call away, an email away if I needed brochures or if I needed whatever if I needed a list of certain documents, legislation, stuff like that. DPC's been right there to help me out, and that's really made a big difference by having a partner organization, because a lot of us start out without any of those national organizations. We're kind of doing things solo, and I cannot tell you how important it is to get involved with a national organization like DPC to help you push that needle forward for all kidney patients and stuff. So I don't want to monopolize the time, so I'll turn it back over to you guys.
Gene, thank you, not only for that feedback, but your continued leadership. So as you can tell, we're a patient advocacy organization. Gene is one of our board members. Chris is one of our most active patient ambassadors. So it's great to hear their stories and hear how much they've been impacting policies in their communities. But actually, I was reminded, yesterday, having some work done on my home, just some electrical work, and the office called me up, and the administrative assistant, thanked me for my work. She said, "I apologize, I meant to get back to you sooner, but they wrote your number down wrong. So I Googled you and saw what you did for a living." And she said, I've never contacted my senators or my representative before, but actually last year I donated a kidney to my brother. And I was just amazed. I'm like, that's wonderful. Is it okay? Can I ask, how's he doing? And she said it took some time for him to get used to his kidney, but after 9 months, he is doing incredible. And so I think what really stood out to me, and what I always tell people, whether they're coming to our fly-in for the first time or they're trying to decide if they get involved with our organization, is all of you really are the experts. And I said, well, we really need people like you, because frankly, you know better than any elected official that you need to take off maybe 6 weeks, 8 weeks to donate that kidney to recover all the time and effort that goes into it, and to share your story and that experience, and for you to be able to go ahead and tell your local elected officials that, you know what, my brother was lucky, he had private insurance coverage, and so he didn't have to worry about the 20% that Medicare doesn't cover. And so, it's urgent and critical for everyone to share those stories, to get involved, to get active. And, I think Chris mentioned coming out of his shell. And so I wanted to give that story just as a transition, so that Chris, if you could talk more about, how this has impacted you, why people should get involved with DPC, and what it's meant for you to be part of the organization, and appreciate it. Did I lose you, Chris? Uh-oh, I think you dropped off. In
Well,
that
that's
case,
okay.
Gene,
I can
jump in
jump
there
in here
too.
and stuff. Something I failed to mention that is very, very important, and I hope everybody on this call listens. DPC is the only patient-led board in the United States as far as a national organization. And let me tell you what that means. That means that you're sitting around a table with folks that have been on dialysis, that have gotten transplants, that have lived years. Harant, maybe something we ought to do is figure out how many years of knowledge, institutional knowledge we have sitting on our board in terms of dialysis and transplants and stuff. But it really makes a difference when we go to make our goals, because everything is patient focused. It's 100% focused on what do we do to help the patient. And that's a great thing about DPC. But while Chris is getting back on here, I'll just jump in. I'm in Oklahoma, and so we've got a B rating on our Medigap program. Not the best, but definitely not the worst. I have definitely taken advantage of it. I'm still on a Medigap program right now, and it's worked well. And I'm so thankful for the efforts that DPC is putting out on a state level, trying to get those changed, because there's a lot of hurting people out there. And that 20%, as Chris had mentioned earlier, you're choosing between, do I buy my milk? Do I put that tank of gas in the car? Do I buy my kids? What do my kids need for school? What about supplies and all these different things and stuff? And they're having to make these life altering decisions. Um, based on them not having any access to care. And so I'm thankful that we are at the forefront of that fight, and we're leading that charge. And I think that we're seeing a lot of success at that with Nevada, with Georgia, and with our patient ambassadors. So if there's folks on this call and you want to get involved, you just got to start somewhere. Just give us a call and we're going to help you start, So it's Chris. Chris, you're back on, brother. I'll turn it back over.
Hey, I'm sorry about that. The power went out and my phone cut off. I apologize for that.
No worries, Chris. Just asking, if you could talk about, you mentioned coming out of your shell and, how important it is for everyone to share their stories. And so if you could explain, if you may have been reluctant, what helped you get over the hump, to really get involved?
What made me get over the hump was I knew that it was more out there than it was just what people was telling me. A lot of people get stories from Dallas's patients. They get a word of mouth, and somebody had actually mentioned that you could advocate, and I was like, well, I really don't. I don't know. I don't think so. And so one day, like I said, I was scrolling through Facebook and I saw the post from DPC, and I was like, well, you know what? I'll give it a try. And I gave it a try, and I talked to Yolanda, and we talked about maybe 30, 45 minutes. She said, well, I'll call you back once we make a decision. And she called me back a couple of days later. And from there, it just took off from that. And I'm asking that anybody that wants to get involved to help us, that we really would appreciate it. And like Gene said, you can give either one of us a call or just call DPC or just Google them. And you can reach out to them and one of us will get back to you. And anybody that we can get to help, please don't hesitate to come help us, because we really appreciate it.
No, I appreciate that encouragement. Absolutely, Chris. And I think one thing we didn't really touch on is that most dialysis patients actually crash into dialysis. It's a little overwhelming, and trying to figure out what your new normal is going to be, how your life is going to change. And I think that one of the most positive things is there's a really strong community of patient advocates that DPC has been developing over the years. And to Gene's point, we're a patient-led board. So while I was asked to highlight and talk about some of our next steps for Medigap, we're actually going to have that discussion with our board on Sunday during our fly-in to talk about the progress we've been making. Which states should we be prioritizing? What additional strategies do we need to consider? What's the pushback that we're getting from insurers or from other opponents of our efforts to provide more affordable access, more affordable coverage? And so I think, I think that's one of the things that I think can be overwhelming is people often, when they're looking for DPC and find us, they're actually looking for, okay, what does this mean as far as my GFR or my creatinine level or other things? And they find the education center first and then end up finding DPC. And so, Gene, I know you kind of jump right in there, with the advocacy efforts. And I feel like sometimes we're playing catch up with you, as much as you're helping us move the organization forward. But, can you talk about what it was like for you using kidney disease as a way to kind of empower and look at the positive side and do something constructive?
Believe it or not, a lot of people might find this as a shock, but I didn't want to post anything on Facebook about my needing a kidney. And my wife, Stacy, just kept on and on about it and stuff until she finally talked me into it. And through doing that, I ended up like Chris I was scrolling on Facebook one day and saw DPC. It was the DPC Education Center. And so I really went there and got to looking at that. And that absolutely was a game changer for me because it was almost a one-stop shop for information when it comes to dialysis, really, and just the kidney disease as a whole. There's things on there, not just dialysis, transplants. There's a lot of stuff on there. So that really helped me out. But so I would just take that information and I memorized a lot of the, what do we got? 800,000 people on dialysis. There's 100,000 people right now that need a kidney transplant. And I go out and I start talking and sharing these stories, and I noticed how many people had no idea about this stuff going on, and I grew up around it. I don't have childhood memories without it because of my family history with PKD. But the kidneys aren't the sexy thing. We're not the big cool thing everybody's talking about, but yet it seems to be with 90% of the organ transplants that are needed, it's kidneys. So this needs to be talked about. There's 37 million Americans right now that have some form of CKD. And so educating them is very, very important. But not only educating the people, the patients, our state legislatures, our federal delegation, they need to hear what's going on in this realm, because trust me, they're getting knocked on by they've got lobbyists in three-piece pinstripe suits going up there lobbying for big corporations. We need to be the lobbyist lobbying for patients like us. We need to be that voice for all those people across the United States that are needing help, the ones that really, really need it, and so it's up to us to carry that torch, to carry those messages, into those capitals, whether it be at your state level, whether it be at your local level, whether it be at your at DC. Haran had mentioned we've got a fly-in coming up this weekend, this next week, where there's going to be dozens of us go charge Capitol Hill and go and talk about dialysis, the needs for Medigap, the importance of making sure that kidney disease is not left left on the wayside. Looking at funding from a few years ago, kidney patients were only getting $19 per patient as funding. Other diseases, and I'm not trying to discount them, we're getting $500, $600, $700 per patient. The research money needs to be put where it's going to help. With 37 million people that need some kind of form of help with kidney disease, we want to make sure that money's going where it needs to be. But anyways, Haran, I'll turn it back over to you.
No, I appreciate that passion, Gene. I mean, that's, something that, it's obviously you're speaking from the heart and from your own personal experience. And that's really what our organization is about. People like yourself who want to make a difference, who maybe were reluctant at first to go ahead and share their story. And I think a lot of people may have been. I had a family history of kidney disease, and and I ran for state office, fell a little short, and wanted to try to figure out how do I make a bigger impact. And unfortunately, I found DPC. Ironically, I was diagnosed with kidney disease a few months later. I've been able to slow my kidney disease progression, but it's obviously a really personal issue for me and all of our staff, but especially our leadership, our board, and really encourage everyone to donate a little bit of time to contact their member of Congress, to share their story, to even just starts with going on our website, dialysispatients.org, and click on the Get Involved. Sign up as a member, sign up as a patient ambassador. And so with that, I'm going to ask Chris and Gene if they've got any final closing thoughts that they would like to share. Chris, go first. Chris, did I lose you? Any thoughts you wanted to share? Closing thoughts?
Oh, I'm sorry. Just get involved. Get involved. Find out what we're about. Go to our website. Find out what we're about and get involved. And you'll be surprised at the information that's there. It's a good organization. It's a great organization. Just get involved and become an ambassador and see where it could lead you. You might be surprised.
I appreciate that. Thanks, Chris. Gene, anything you want to add as well?
Well, I would just tell you, a lot of folks ask, hey, what can I do? Maybe I'm in a wheelchair. Maybe I can't move around a whole lot. You can write letters. You can send emails to your congressman. You can go make visits to the local office. Go see the field reps. Let them know what's going on in your area. Let them know what you're doing and stuff. They may want to be involved in it. I've written letters to every congressman and senator for the last several years, letting them know, hey, this is where I'm at. This is my experience, and I know others are like it. Can you please look at this bill and consider co-authoring it or authoring or, introducing some legislation that's going to help A, B, or C out and stuff. There are a multitude of things to do. Just don't let anybody tell you no, and just don't let those stumbling blocks stop you. Turn those stumbling blocks into stepping stones, and I assure you, things are going to begin to happen. You just got to keep pushing forward. Consistency is the key, because sooner or later, they're going to start calling you when they have a question about stuff. For instance, I've already been on the phone with the senator's office calling me because they had a constituent calling them about an insurance question. They called me. I love that. I love that I was able to give them the answer that they needed. Had another call yesterday from a social worker in a clinic. I'm not going to say the state, but anyways, they uh, they were needing some help, and so they called me. We got them everything they needed, and boom, it's all taken care of. You can become such a catalyst in your community to help force that positive change. You just got to get involved, and so we just want to encourage you all. Hopefully, we'll get to see some of you all at the fly-in, and go check out DPC. Go join DPC. I promise you. Nancy, Yolanda, everybody's going to take care of you and stuff. And again, call Chris, call me, call her. And I'm going to say something about Harant. Harant's the only CEO that I know that shows up to local events, that'll fly across country just to come and speak. He shows up to every one of our things, and I'm so thankful for that because it means our leaders really care, you know. And so couldn't say enough about DPC. I'm going to shut up. I've talked too much, but y'all, we want you to be a part of DPC. We want you to be a part of this family, and we hope to see you soon and connect with you soon.
Thanks, Gene. Thanks, Chris. I want to thank both of you again for serving as panelists. And then also just reiterate we need everyone to get involved. DPC is working hard to make sure that patients get the insurance coverage that they need, that they get the support that they need. But we need everyone that we can to share their stories, to educate policymakers. I mean, you guys are the ones who really impact and help us move our agenda forward. And appreciate the kind words from both of you guys about our organization, about the work that we do. And so I think, Nancy wanted to make a couple of quick comments on closing, since this was an education center, hosted event. So wanted to thank the Education Center for inviting us to speak first for this new effort to emphasize advocacy, because while we started as an advocacy organization, we recognize that patients really, when they go online, when they look for things in social media, it's what can I do to improve my healthcare? It's not how do I contact Congress? How do I contact my state legislator? And as they learn more about the issues, they realize that, public policymakers are the ones that really have the biggest impact on, their well-being and their access to high quality care. And so, Nancy, I'll let you make the final closing comments on behalf of the Education Center, and thank everyone for participating in this discussion.
Thank you, Harant. Chris and Jean, you make me proud. You really do. And in our support group on Tuesday, we talked about empowerment, and knowledge is empowerment. And that's what the Education Center is about. And Chris and Jean, you are definitely empowered, and that gives you the authority to empower others. So you are doing that by passing the torch. You're doing it by talking about what we do as an organization. And everybody that knows me knows how territorial I am about DPC. And I just really thank you so much. Really, your stories were very impactful. And thank you so much for being a part of Dialysis Patient Citizens. And thank you, Harant, for allowing this to even happen, because I don't even know of a lot of organizations that are doing this. So spread the word, tell a friend. We have a capacity of 100 that we can put on this Zoom, but I'm shooting for 500. Okay. So thank you so much, and everybody have a great day. Thank you.
Well, thank you, everyone. Take care.